Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
The ongoing fight against coronavirus tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian. Thanks for joining us. I am joined tonight by Dr. Elisa Haushalter, Director of the Shelby County Health Department. Thank you for being here.
Thank you for having me.
Along with County Mayor Lee Harris. Thank you for being here.
Sure thing.
And Bill Dries, reporter with the Daily Memphian. So we'll try to get through everything we can. We have tons of questions and go through everything, a kind of situation update of where we are as we tape this Thursday morning to sort of where we're going, the economic impact, and just as much as we can get to. We may go a little long today just because obviously this is so important. There's so many things to talk about. Let's start with, as of yesterday, and it's a little time warp because this is airing on Friday, but as of yesterday, I think there were 218 confirmed cases in the area. Is that about right?
Well, we have 198 in Shelby County.
In Shelby County.
And about
okay.
218 in surrounding counties and Shelby County.
In surrounding counties. And so far, thankfully, no fatalities.
Correct.
Where are you in terms of the expected growth in confirmed cases? Do we have a sense of how fast we're going to be growing?
So internationally and then now nationally, the data would indicate that about every 5th to 7th day, the cases double.
Okay.
So that's why it's critical to take early aggressive action to reduce that doubling within the 5 to 7 day window.
That is muddied by the inability to test as many people as I think everyone would like. I assume you still don't have, Shelby County doesn't have enough tests. Is that correct?
Well, I think that's a myth that people believe, is that we don't have sufficient testing. We actually have not had difficulty accessing testing. When we had our first cases, we had to work closely with the Centers for Disease Control and the state health department, but anyone who fit the CDC criteria for testing was able to be tested. That's why we were able to find our early cases, and now with expansion into commercial labs, individuals have been able to access testing. We did run some data yesterday, and what we do know is that people in more affluent communities and people who have health coverage or health insurance are more likely to access testing. So today what we'll be doing is looking at how do we assure where there are communities where people don't have insurance coverage that they have equal access to testing as well.
We talked last week with Dr. John McCullers and his associate from both Le Bonheur and UTHSC. He's pediatrician in chief at Le Bonheur, but also an infectious disease expert. He talked about the difficulty, and I'll paraphrase loosely, the difficulty right now, the criteria the CDC has laid out is very, very high.
Right.
He would prefer to be able to test far more people. And in that sense, and this was about a week ago, he said there aren't near enough tests. And I've read in some communities, everyone it seems to have a different approach.
Right.
Isn't the goal ultimately, though, to test as many people as possible, not just those who meet the very high bar of the CDC standards?
I think ultimately that's the goal, but when you have limited resources, you start with what are the criteria for testing. You do what's called very targeted testing,
sure.
And that's the individuals who are most infectious, and those are typically people who are exhibiting signs and symptoms, but there are tests. It's expanded considerably probably since your interview with Dr. McCullers. AEL is a commercial lab that's running specimens 24 hours a day. Quest and LabCorp now also run specimens. Most of our community-based clinics are able to do testing, and then University of Tennessee has opened up a drive-through testing. So it's changed significantly over a week to 2 weeks, and that'll allow us then to test more individuals.
And he had previewed that. So thank you for clarifying that. How many people have been tested?
The raw number in Shelby County I don't have, and the reason why, there's 2 reasons for that, is typically in the state of Tennessee, the only thing that's reportable is the actual disease. So the positive test result is typically reported to a local health department and the state health department.
Right.
However, with COVID-19, the state has asked that labs submit all tests run, including the positives. However, that's now calculated at the state level, and we're working with the state to be able to have that information in Shelby County.
Doesn't that skew everything? Like if we know we have, let's call it 200, right around 200 confirmed cases, but we don't know how many, that's out of 10,000 tests? 1,000 tests? I mean, if it's let's say it's out of 1,000 tests, that's pretty scary that, 1 out of 5 people who gets tested is confirmed. If it's out of 100,000 tests, well, then it's much more calming. So how do we get that bottom number, the denominator of that formula?
We'll look to get that number hopefully within a week to have accurate information. And that is something that is very important. I don't want to downplay the importance of that information. It gives us what's called a positivity rate, and it tells us 2 things. One, how many people are positive out of the total pool tested, but it also tells us, are we testing the right people? So I'll use Korea as an example. They did mass testing. Only 4% of those were positive. That means 96% of the people tested did not need tested. And so you look at it for those 2 reasons, but the more critical piece is that we know the individuals who are tested positive are spreading disease in our community, and so that number is significant regardless of the denominator.
Okay, and you think? Did you say you think in a week we'll have a better sense of that denominator and thus the positivity rate?
Correct.
Because it's going to come back down from the state
Correct.
as both private labs, public, all testing.
Yes.
Okay. We'll come back to a bunch of things we raised there, but let me get the mayor in. Rare that you are the second person I go to in an interview. Usually the mayor goes first, but at this time, I think we all wanted to hear from Dr. Haushalter. Your sense right now, as county mayor, I mean, we were talking before the show, 10, 12 days ago, life seemed very normal, and particularly the economic impact and the kind of social impact on the people of Shelby County. What is your sense of that? I mean, this is a wild and damaging and really kind of scary thing, both economically and socially and personally, for what has happened to people in this last 10 to 12 days.
Yeah, no doubt about it. In less than 2 weeks, things have moved really rapidly. I think the world changed. It's hard to even go back in time and to think about the kinds of things we were thinking about prior to the declaration of a world pandemic, the closure of the schools, and the rapid expansion of the number of cases we see here in Shelby County. There's no doubt that this is a major disruption to our way of life, and the local government's been called on to use tools that no one contemplated when they ran for office. And so you have seen declarations of emergency to try to get folks to limit their activities to really essential activities, all in an effort to try to slow the spread of the virus down and in an effort to promote the key ingredient to slowing it down, which is social distance. So things have changed really rapidly, really fast. I like to say we have been asked to build an airplane while flying it and to do it up against a 1-minute timer.
And before I go to Bill, and I will go to Bill, and I apologize, Bill, is it been an overreaction? And you get, there's start at a national level, at a local level, sometimes it's whispers, sometimes it's people writing, that the economic impact of this to small businesses, particularly medium-sized businesses, not just the restaurants, but all kinds of, from mom and pops to companies of 1,000 people in Memphis who have suddenly laid these people off. As we talk, on Thursday morning, the national unemployment filings were 3.3 million, a record. I'm sure that is just the start. I don't think anyone would say otherwise. We don't have the state or local numbers yet. Was this an overreaction given the economic and damage that's been done?
So I don't think so. I think at the local level, all of us have really been trying to focus and prioritize saving lives as much as possible, to really take a look at the long-term implications of what happens if we run out of hospital beds and people need severe or intensive treatments. And so I think that has been the focus of conversation, and rightly so. There's no doubt about it, though, in the community at large, there is some level of panic, and I think the way we combat that panic is making sure we have conversations very often, that we're transparent, that we put credible people in front of the community, and that we base our decisions as best we can on information and science. So right now, Director Haushalter is having a daily briefing that's well attended by the press. Thank you for being in attendance there, to get out that information and to make things as transparent as possible. And hopefully that will tamp down what you're talking about, because there is some panic out there. People are seeing this on CNN. There's a national conversation right now. And that conversation is around infectiousness of the virus and fatality rates, and it's not right now around all the issues that are involved.
Okay, Bill.
One of the more interesting things is that you've been involved in some issues that have carried over into this in a very unexpected way. For instance, you were very interested in cash bail reform in the criminal justice system. Now you're about to put together a plan, as I understand it, to be able to release people from the Shelby County Jail who have the exact same kind of low bails that they can't make on this. And I believe you said your deadline for a plan is Monday to be able to get this done?
That's right. So bail reform is a really centerpiece of criminal justice reform. It's a really tough thing to do, to say how do we make sure that folks who are not a risk to our public safety and are not a flight risk, they're not going to miss their court date, how do we make sure that they are not detained and that we can release them? What is the process for doing that? Normally, it would take us a term or two to get such an important reform in place, right? A 4-year term or two to get such an important reform in place. Right now, we're trying to do that in a matter of days. The Tennessee Supreme Court has asked us to deliver a plan, I believe, by March 30th, whatever March 30th is, I think, which is next week. So they've asked to deliver a plan by March 30th. The district attorney, Amy Wyrick, is really taking a leadership role there with significant input from the sheriff and the public defender and yours truly. And I'm hopeful that we'll be able to do something significant because the population, like you kind of alluded to, the jail population is really vulnerable to infection. The jail population tends to have pre-existing conditions, and they tend to be clustered in very, very tight, small spaces. And so spread is more of a worry there than in other places. And so we're hopeful in the next few days we'll have a plan in place. But you're right, we're doing this at lightning speed, but the good news is all of us are really operating together. I mean, I think we see a united, concerted effort among municipal mayors, municipal leaders, also countywide elected officials, health department officials, scientists and hospitals, chief medical officers. So that's the good news, that there's a real great coordinated response, and we are getting information out to the public, and I think that's bringing down some of the panic and anxiety.
Is there a balance between the measures that need to be taken, that you're hearing from the experts, including Dr. Haushalter, and the damage to the economy that we're seeing? Do you go for absolutely let's stop this in its tracks, or do you look over your shoulder every once in a while and say, yeah, but if we go this far, this causes severe economic damage?
I think we'll have that conversation, and I think we need to look over our shoulders often. There are countervailing considerations, there is no doubt about it, and we need to have a real comprehensive conversation as a community. So you're right that if this major disruption lasts 30 days or more than 30 days, which is anticipated by the way, that will cause a lot of businesses to never come back. A lot of folks, the livelihoods they built up over a lifetime will completely vanish, and we may never get any of that back. So we have to talk about all these things. I think the major priority for everybody at the local level is how do we avoid risk? How do we make sure that people who need treatment get treatment, and how do we save lives? But yeah, we've got to consider the other countervailing considerations.
Dr. Haushalter, is this as simple as do this now, flatten the curve on this, take these measures, and then you won't have to worry about what could be temporary damage to the economy? I mean, does that even enter into your thinking with what your responsibilities are?
Yes, it does enter into our thinking significantly. A lot of it is about timing. It is about watching those case rates, the exponential growth of those rates, and determining what is the right time to implement more aggressive measures. And those are recommendations that we made to Mayor Harris based on how we saw the numbers growing, and recognize there's not just economic impact, but there's significant social impact. And, the inability to visit our elders in the nursing home, to have our children go to school, all those things really impact our community, go way beyond economics.
We talked some here about hospitals, so let's get to that. As I understand it, and I could be wrong, as I understand it, a lot of this notion of flattening the curve is to eliminate spread, but it's also to mitigate the impact on local hospital systems. Is that fair? I mean, so that you don't get a flood of people going into the hospitals very, very sick.
Yes, I would say it's two things. One is we want to reduce the number of people who are severely ill and require hospitalization. So that's a population issue, is that we don't want those most vulnerable to be the sickest. Then the outgrowth of that tends to be the impact on the hospital itself. And then there becomes really serious ethical dilemmas, and we're seeing that in Italy. If you have limited bed capacity, who gets that bed and who does not? Who gets the ventilator and who does not? So it's also avoiding the ethical dilemma that comes with making decisions, and where we've seen that most in the United States with post-Katrina.
Yeah.
And so I think given where we live, we're really aware, particularly in public health, of the ethical dilemmas that occur when you have severe shortages in hospital beds, ventilators, and also I have to indicate the shortage of staffing.
Yeah.
We have a nursing shortage across the United States.
And you're a nurse.
I'm a nurse, and those are the individuals that will provide bedside care. And if those individuals get sick and they're really on the front lines, how are we going to provide care to the people who need it most? And that ultimately ends in lives lost.
And again, it gets forgotten, not by you, but by some of the hospitals also, there are car crashes, unfortunately. There are people who have heart attacks. There are people who have emergency care that also need to go into the hospital. It has nothing to do whatsoever with coronavirus at the same time.
Exactly.
Yeah.
And so we have to be able to serve those individuals as well.
Of the 200 or so, I'm really bad on numbers today, and I
Okay.
apologize. But again, as of Thursday, about the 200 or so confirmed cases in the region, how many have required hospitalization?
Only about 10. So
Okay,
it's
so-
again the importance of flattening the curve. But the other information that we have just as of yesterday is the majority of our cases are in people under 60. So we are
that's
not
important.
right. We are not impacting the most vulnerable population yet. So we want to reduce transmission now before it gets into the population that's going to need the hospitalization.
What is the capacity of the local hospitals in terms of ICU beds? What's that number?
So there's a lot of variability. I just shared with with the mayor that there was about 500 beds available this morning. That was including ICU beds. It's not as a sort of black and white answer. There is a system called the Health Resource Tracking System where hospitals upload every day what their current bed capacity is, vacant beds, including ICU. But we also ultimately have to look at, can they convert other beds to ICU beds? Can they move people out of the hospital? So it's very much a sort of moving target to some degree, but it is monitored, and we're currently, the health department along with Dr. Jane are looking at predicting when we see that surge and what are the other ways that we can expand hospital capacity.
Again, that give or take, that roughly 500 capacity, is that empty beds right now or 500 total, some of which
No,
may be
that's
full?
empty. That would
Empty
be
beds,
right.
500. So some of them are full from, again, heart attacks or other things that might have unfortunately gone on at this time.
Right, that's
And-
not in the 500. 500 are what's open
Yeah.
that could be used if need be.
And then that's across all the hospitals we think of in Shelby County, or does that include DeSoto County? Or
So it looks within the region in part because you have larger systems that may have hospitals in both.
Baptist has a big hospital
Right.
down in DeSoto County, so that includes the region.
Right.
Okay. In terms of supplies, the key stuff people talk about, ventilators, masks, where are the hospitals in terms of their availability?
So I
of
don't know the
supplies?
exact number. This morning, I apologize for that, but there are significant ventilators available currently and others that can be moved between systems. Really where there's a challenge right now is in personal protective equipment and
Masks,
particularly,
gloves,
right, and particularly in basic surgical masks and then the N95 masks. A lot of the newer evidence says a basic surgical mask will be sufficient in serving customers and patients in a variety of settings. And so those masks are what's needed most currently.
And the coordination among the hospitals, the CEOs of the major hospitals came out with a joint statement. It seems like a long time ago. I think it was Monday. Maybe it was Sunday actually. Saying they would work together. Does that mean that they are sharing resources and coordinating availability? What does that mean?
Yeah,
from
so
your
it
point of
means
view?
sharing data, but also means planning together, which is really important. This is about planning and being ready when it happens, and then agreements to be able to do several things. One might be divert patients from one facility to another, and the example I'll use, we only have one trauma center. So we want those trauma beds for patients who experience trauma. So it could be diverting patients.
Trauma would be unrelated to coronavirus. Most
Correct.
likely. Again, back to the
Motor
car wreck
vehicle
and so-
crashes, those kind of things, and then
And that's at the Med or Regional 1.
yes,
Okay.
Regional 1, and sharing supplies as needed.
Last thing, and then I go to Bill. With about 6 minutes left here, we talk about Mississippi as if the region, but that's an entirely different state, an entirely different municipality, an entirely different county. The county mayor here has no authority over what happens in DeSoto County, not far from where we sit right now. Same with Crittenden. There's a lot of back and forth in normal times, but even in these abnormal times with distribution and logistics, and it's not that people can't travel. Are you worried? Are you in touch with your counterpart in DeSoto County? And is there good communication and coordination? And same with Crittenden across in Arkansas. Is there good coordination across state boundaries?
So I'd say coordination is occurring more at the emergency management level. Within public health, when we start crossing state lines, we actually go through the state health department. So there is communications, but it's not direct. It's through this.
Are you worried?
No, I'm not worried about that.
Okay.
I think we have all stepped up and leaned in, to use a euphemism, to be able to address this issue. And we work closely with Crittenden and DeSoto County, particularly on HIV and the AIDS epidemic. And so we look forward to continuing to work with them in this crisis.
Bill.
Mayor, your confidence level, this is a lot of moving parts to coordinate. Is the coordination working?
Well, yeah, I think that's one of the bright spots. I think one of the bright spots is that everybody is been pressed into service, and everybody seems to be working very well together. So we've got city, county task force. In addition to that, the municipal mayors, Arlington, Bartlett, Collierville, Memphis, Millington, Lakeland, and Germantown. The mayors of all those cities are really committed to this effort to reduce spread and to encourage social distancing. I talk to them relatively often, and they're all very capable and know their constituencies very well and are able to communicate with those constituencies the need around these issues. I've got a call today, our second call, and we're going to start accelerating some of this. Our second call with the neighboring counties, so Tipton, Lauderdale, and Fayette, the mayors of those counties, who are also very interested in making sure they join this effort. The reality is if we close down restaurants in Memphis but leave the restaurants open in Collierville, then some of the on-site gathering just migrates from Memphis to Collierville, and so we've all got to be in this together. So I think that's one of the real bright spots here. One more word about the regional impact, and this is something I'm trying to still understand, is obviously we didn't expand Medicaid in Tennessee, and so the failure to expand Medicaid in Tennessee has hit the bottom lines of a lot of hospitals. We've seen a lot of hospital closures, and so some of that bed capacity eliminated. And so since we do have bed capacity in Shelby County, my expectation, right, as I sit here today, is that some of our bed capacity will be devoted to some of the regional need, because some of that hospital capacity has been eliminated because Medicaid expansion didn't happen, and so those hospitals couldn't survive. So we'll not only be servicing, again, this is what I see coming down the pike, not only servicing need in Shelby County, but some of that regional need as well.
Mm-hmm. Before the World Health Organization declared COVID-19 a pandemic, you had a trip with the Memphis in May delegation to Ghana, which is the honored country at this year's festival, which has been delayed. Talk to me about your feelings. You're in Ghana, and word comes down that this is a pandemic. Your reaction to that?
So it happened so rapidly. I think we were all surprised by that, and so at that point, we just tried to get back to town as soon as possible. The reality is Memphis in May. Obviously, Memphis is a tourism mecca. We have over 12 million visitors to Memphis every single year. That means 30,000 a day, 30,000 visitors a day, and so that's really one of the centerpieces of our economy. And so Memphis in May is the showpiece for that part of our, of tourism and so forth. And this was one of the first times in recent history where we were going to honor African American and the African diaspora, African American heritage and the African diaspora. As one of the top African American elected officials, I think it's my responsibility to make sure that we celebrate and honor the accomplishments and the heritage of African Americans. And so, although I don't like travel, right, I don't go to conferences in Las Vegas, have never been to a conference in Las Vegas or in Florida or even in New York City, never in 9 years of elected office. I do think that it is important to honor the diversity that we have in this urban county.
With just 2 minutes left, and we will go long and put it on the podcast, which I'll talk about in a second. In hindsight, would you have come back sooner?
I'm happy to talk about travel as much as you would like, and no, I would not have. Okay. I would not have gone at all if I could go back in time.
That's fine. I just want to make sure I ask that question. With 2 minutes left, and then we're going to go long, and so there'll be extra conversation with our guests today on the podcast, which will be on the Daily Memphian site. It'll be on Spotify, iTunes, wherever you get your podcast. But while we're still on video here, if people feel they have symptoms, what should they do?
First thing is stay home. Don't go to work. Don't go out in public. That's a critical piece. We've seen consistently that people have gone to work while they were symptomatic. So stay home. Contact their healthcare provider.
If they don't have one.
We have a really strong safety net system in Shelby County, and all of those community-based clinics field calls.
And that's things like Christ Community, Church Health Center.
Resurrection Health, and so on, and they can reach out to them.
Are those listed somewhere? How do they get?
So they're listed on the Shelby TN coronavirus website, as well as on the City of Memphis coronavirus website.
Okay. The drive-by testing that is started at Tiger Lane. Can anybody go there? How does that work?
No, that actually is referral by a healthcare provider.
Okay.
And so they're still beta testing that, but once it's up and running, the first phase is those that a healthcare provider has deemed necessary to be testing will be tested, and then ultimately there may be more wide-scale testing.
If what the symptoms that people should be looking for?
So it's flu-like symptoms. So muscle aches and pains, runny nose, cough, shortness of breath, and a fever. Some people may or may not have GI problems like diarrhea.
Okay. We're going to stop in terms of the show right now, but if you go to the Daily Memphian website or wherever you get your podcast, the Behind the Headlines podcast will go long today, and we'll get some more questions in with our two guests. Please, thanks for joining us. Join us again next week, and again, download the podcast.